Good morning. I will be talking about evolution of rotary instruments in endodontics. The goal of root canal treatment is to clean and shape the root canal system and to fill it in all the three dimensions. There have been numerous concepts, strategies, and techniques for preparing root canal system from the beginning of modern day endodontics. Throughout these decades, a number of files has emerged for negotiating and shaping canals. The first endodontic file was crafted by notching a round wire at first from watch springs and then from piano wires in the mid 1800s. Then stainless steel K files were developed by the Care Company in the 1915s, and then came the game changer of endodontics, the nickel titanium alloy. So, what are the advantages of nickel titanium? It is flexible, it is biocompatible, and added advantages it is resistant to corrosion, and it has two properties called as shape memory and super elasticity, which makes it a unique one, and that is why it is mainly used in endodontics. And the first nickel titanium wire was introduced by Buehler, and it is termed as nitinol, which is developed by Naval Ordnance Laboratory. So as I told, the property super elasticity and shape memory is the key in endodontics. It is possible because of two crystalline phases. The nickel titanium alloy exists in two phases, which is called as austenitic and martensitic phase. The austenitic phase is a body-centered cubic lattice shape, and it is stable in high temperature, and the properties are it is rigid, it is super elastic. And when we decrease the temperature, which is called as a critical transformation temperature, it will turn to martensitic phase, which is hexagonal lattice, and the properties change from rigid to soft. It is more ductile, it exhibits more shape memory. And there is an intermediate phase in between austenitic and martensitic, which is called as R phase. So we can convert austenitic to martensitic by two ways, either by inducing stress or by temperature. So both phases have certain advantages. So we can compare, we can take the best from both wells by transforming by either by stress, temperature, or by a combination. So conventional nickel titanium alloy is austenitic, and we have different combinations of austenitic and martensitic, and different manufacturers call it as R phase, M wire, control memory wire, gold heat treated, blue heat treated, max wire, T wire, C wire, etc. It is nothing but basically a transformed alloy, varying degrees of martensitic and austenitic phases. So the main properties, which is of our concern is cyclic fatigue and torsional fatigue, which leads to fracture of an endodontic file. Cyclic fatigue is nothing but the tension will add up by repeated use, and it may lead to failure or fracture. Torsional failure means if you exceed the torsional force of a file, it will fracture. And some properties such as centering ability, such as to follow the shape of the canal, transportation of canal, we have to avoid that. And reduction in bacteria, the amount of microcracks formed, the debris extruded while used, etc. are some of the properties we have to check when we introduce a new file system. So there are certain design characters. First one is taper. It is nothing but the amount of file diameter which increases along the working surface from tip towards the handle. Historically, it is at 2%, which means it needs millimeter, it will increase the diameter by 2 millimeter. So tapers can be either 2, 4, 6, etc. Flute is nothing but a groove in the working surface used to collect the soft tissue. Land, it is nothing but a surface projects axially from the central axis as far as the cutting edge between flutes. This surface is called land. These are the different design characters of a rotary file, which means it is the distance between spirals and flutes per unit length. We have files with constant pitch and variable pitch. Helix angle is the angle formed by the cutting edge with the long axis of the file. Rake angle, it is the angle formed by the leading edge and the radius of the file. If the angle formed by the leading edge and the surface is obtuse, it is called as positive. If it is acute, it is said to be negative. Positive angle files will tend to cut more. So if you take any nickel titanium rotary file, we will have these design features. Now moving on to evolution of nickel titanium. So evolution is covered in mainly 4 headings: evolution in file design, evolution in filing motions, metallurgy. So basically it is divided into 5 generations. Either it can be evolution in file design, evolution in file motion, or evolution in metallurgy. So first generation is nothing but basically a 2 taper file. Dr. Johnson introduced the profile series, which is available in 4 and 6 taper. He is called as the father of nickel titanium, so father of rotary endodontics. And first generation file, another example is greater taper files, which is introduced by Buchanan. Lightspeed is introduced by Senia, LSX. The characters of this file is all have a neutral or negative right angle, which means there will be less cutting. There is fixed taper, which can use more number of files, and there is incidence of high separation. Examples are profile GT, Quandex system, Lightspeed system, and Lightspeed LSX. Second generation was introduced by the end of 1990s. Here we have positive right angles. So, and this generation introduced files of different types rather than 2 or 4. It introduced variable type. The examples are ProTaper Universal, K3, and BioRace. And the ProTaper system is considered as the gold standard in second generation system. ProTaper means progressive taper files, which consist of a orifice opener, which is termed as SX, 2 shaping files, S1 and S2, and 3 finishing files, F1, F2, and F3. And it also introduced a set of retreatment files, which is termed as D1, D2, and D3. And another example is K3 file system. Again, it will be positive right angle, M2, liberator, B taper system. So one limitation of the second generation systems were the when compared to first generation, it is flexible, but we want more flexibility, and the incidence of separation was higher in the second generation. So in third generation came the advance in metallurgy. As I told earlier, different types of wires, wire control, memory wire, gold, blue, etc. So control memory and K3XF are examples. Fourth generation, all these first, second, and third generation were using a rotary motion. So the fourth generation introduced a new motion, that is reciprocatory motion. Examples are wave and gold, reciproc system, etc. Fifth generation, to extrude the debris more and to prevent the extrusion of debris, they designed the file such as the center of mass and center of rotation is offset. So it will cause something called as a swaggering action or staggering movement. The examples are ProTaper Next. They called it as a swaggering movement, whereas the Revo company called it as snake-like movement. So again, to one another area of interest was to we are moving towards minimally invasive dentistry. So in order to preserve the precious pericervical dentin, some other files are introduced such as true anatomy system. So to conclude, the new endodontic files for root canal instrumentation are put on the market non-stop. We will have new launch every month or every year. The safest, most efficient, and simplest file system utilize the most proven design features from the past, but it is coupled with the most recent technological advancement currently available. So, what you say? So, whichever file you use, we have to be thorough about the metallurgy, about the design features, etc. Thank you.